I would say for older adults, particularly those who have mobility issues and often are homebound and can't get to the doctor's office, would be a good example of where remote monitoring could be of assistance. I also think because of established disparities in the way care gets delivered, that people living in rural environments might benefit more than people living who might be proximate to their physician's office. So those would be the groups that I think could benefit. Not to say that people in these other groups wouldn't benefit, but I think that those might be the groups that we target first. The first is, imagine your smartphone being something that people carried around with them. These tools are smart for a reason. They have lots of technologies. They have accelerometry, which can measure activity level and where people are in space. They can measure whether people are active or inactive, how long they stay in a stationary position. So there's a lot of information that can be gathered using passive modes of data collection where people don't have to enter any data. I think we would at some point be asking people to generate some information, self-report that could be entered into the phone. This information could be transmitted easily to their provider who might hopefully react to it, and then process that information and then make a management decision about whether a change in care might be of value. So that's sort of how we're envisioning this, as sort of mobile devices. Some are, we're seeing wearable sensors such as Fitbits that can transmit and tell people how much physical activity they do. So the devices do a variety of things. They can track and record symptoms over time. They can be used to deliver interventions, and we've done something like that recently where we delivered a social support intervention as a text message to patients with chronic pain and showed that it reduced pain and improved depressive symptoms. These are tools that can also prompt people as reminders, so you should think about doing exercise today, and in fact our center has supported the development of an app that tracks a person's physical activity level, analyzes it. When they drop below a threshold, it sends them a prompt saying, have you thought about maybe walking in Central Park today? And what's nice about the app is it is tailored to the local environment, so the suggestions are appropriate for that individual person. So those are the kinds of ways that I think we can imagine the tools helping. For older adults, many of them can be socially isolated, and the tools, as you well know and I know, can serve a way of helping to enhance socialization. So there are a number of putative benefits, but those benefits need to be demonstrated in rigorous studies. Absolutely. These devices, in fact, there are a number of apps on the market now that instruct people in the use of meditation, mindfulness techniques. Sadly, many of these apps have not been subjected to rigorous evaluation, even though they claim to provide benefit to patients. We can't say with certainty that that's the case. But yes, the answer is these tools can serve as vehicles to deliver non-drug therapies to patients and instruct them. So I would put that in the category of skills training, giving people the skills to better self-manage pain.